I'm Dr. Matt Gammons. I'm the Medical Director of Sports Medicine at the Vermont Orthopedic Clinic and Rutland Regional Medical Center. I chose the field of sports medicine, I think mostly because that was a lot of my exposure as an athlete growing up. And I played both in high school and college and a little bit afterwards, and certainly had my share of injuries. You know, my initial thought was that I might want to be an orthopedic surgeon, but as I found, I think my skill set fit a little bit better to go with what we describe as primary care sports medicine or non-operative sports medicine, where I'm really dealing with a lot of those issues that don't need surgery, along with a lot of the other medical issues that athletes deal with, including concussions and other things that might affect their ability to play and be active. Being a doctor is much more than just, memorizing sort of what's in the book. And, there are people, my mom, of course, was a nurse, and just all the people all the way up through my training where you saw physicians and even staff that interacted with patients and showed me really how this isn't about a specific injury. It's really about treating the whole person. There's so many moments that make up the best moments, and some of the best moments for me are those days when I come home exhausted, but I know that I did the best I could all day long for every patient that I saw. I think, again, in medicine, sometimes we get focused on the spectacular or the elite athlete or somebody that we had the opportunity to take care of, but it's really the day-to-day interaction with patients that gives me the most satisfaction. One of the biggest advancements in the field of sports medicine has been the use of portable ultrasound machines. We can use them in the office, and we can see a lot of anatomy that we used to not be able to see or had to wait for other imaging. It's great for the doctor because we can get information and feedback right away. It's great for the patient because they often don't have to go get another test and then come back. It's really made a big difference in how we practice medicine. Rutland Regional Medical Center and our clinics are big enough to have resources, but small enough to be adaptive. And that's really where our strength is, because at a bigger hospital system, sometimes it's easier to get lost. We're very lucky here to be the right size for our community to take excellent care of our patients. So when I'm not at the office, I spend a lot of time with my family, my wife and my two girls. And so my girls are 6 and 8 now, and so it's a wonderful age where we get to kind of go do a lot of things as a family that we couldn't do before. So just spending time at the lake and swimming, riding bikes, playing golf, going hiking, all those sort of things. Working at Rutland Regional Medical Center and the Vermont Orthopedic Clinic is a real privilege. I know here that the whole system is designed to support me taking the optimal care of the patient who's in front of me. I really believe that, by the way.